Today I'm going to be talking to you about one of the most exciting reform areas in mental health care. It's a 21st century reform, and it's focused on early intervention for emerging mental disorders in young people. If we look at the burden of disease across the lifespan, we see that over 50, there's a significant increase in new cases of disorder, of disease, most of which is new cases of physical illness. Also in younger children we see a significant level of physical illness, but from puberty through to the mid-20s and even into middle age, people are very physically healthy these days. And the main cause of ill health in this age group is mental illness and substance use disorders. We see from puberty through to the early and mid-20s a significant surge of new cases, and 60% of the health problems in this age group are mental and substance use disorders. So up until now we haven't had a system of care that has really provided any decent access to these young people in the early stages of potentially lifelong mental disorders. From Australian data, we see for the National Mental Health Survey, and I think it's very similar in most Western and developed countries, very poor levels of access, such that only 25% of young people with emerging mental disorders get any access to mental health care at all. And this sinks to as low as 13% in young men. This is an appalling situation. So what we see in the real world of mental health care is late intervention. And in this slide here you can see what the mental health system is doing. It's understaffed, under-resourced, coming on the scene late in the piece for a minority of people who need help, and coming on the scene late in the piece when a lot of collateral damage has been done. So if we look at the bridge and we see young people making the transition from childhood to adulthood, the peak period of risk for mental disorders, the bridge is very shaky, there's no safety net. And that's the experience of people all around the world in this stage of life. 50% of young people between the ages of 18 and 25 will meet the criteria for a mental disorder of some kind, mild, moderate or severe. So it's been treated as just part of life, part of growing pains, part of something that people have to accept, when in actual fact it's a threat to survival, it's a threat to prosperity and well-being. A New Zealand study recently showed that if young people do experience mental ill health, even if it's mild to moderate during this stage of life, they earn less money, they have fewer friends, and they have less vocational achievement at the age of 30. So it's not a trivial issue. And it may well be the early signs of something potentially very serious which can disable across many decades. This is what the system currently provides. Long delays, poor access, slower and less complete recovery when people are treated, a lot of psychosocial damage, all the things that are listed on this slide, including offending behaviour, substance abuse and suicidal behaviour. Tremendous pressures on families, and if people do get treated, it's often a very traumatic and unsatisfactory engagement with healthcare services. So early intervention, which has been conspicuously absent from mental health care until the last 10 or 15 years, is a key principle that we need to extend into mental health care, just like we see it in cancer, diabetes, heart disease and other areas of health care. It's surprising how late this idea has come to psychiatry, and also how strongly it's been resisted by some professionals and some groups within the mental health field itself. There's been a lot of research and a lot of service reform conducted around the world in recent years, and we've seen particularly strong progress in developing systems for early intervention for psychotic illnesses like schizophrenia. In hundreds of locations around the world and in many national systems, we've seen investment in this very important and highly cost-effective reform process, notably in the UK, in the Netherlands, in Denmark, in Canada, in parts of Australia, the US and New Zealand, and even parts of Asia as well. So it's a very encouraging change. It needs to go further, though, to encompass the full range of mental disorders in young people, including mood disorders, personality, substance use disorders, eating disorders, and so on. And to do this, we need a two-tiered approach. In Australia, in the last 6 or 7 years, we've seen substantial investment in the creation of stigma-free primary care platforms under the banner Headspace. Now, these one-stop shops are in 30 locations around Australia, in all states and territories, and we're seeing our government now investing to expand this system to 90 sites with stronger investment. And ultimately, this will provide care to 100,000 young Australians who'd never previously experienced it. It's a holistic model. It's not the extension of medical-based approaches. It's a holistic biopsychosocial approach which provides stigma-free support, information, and increasingly specialised psychological and eventually medical care if that's required for emerging mental health problems and disorders. And it integrates the care of substance use disorders and mental health disorders in a one-stop shop. It also promotes vocational recovery as a key goal so that the young people and their families are supported to stay on the trajectory for normal development and fostering well-being and good psychosocial outcomes. This system needs to be backed up by a more specialised system of youth mental health care, delivering early intervention across the diagnostic spectrum. So that means that if people have more complex or severe forms of mental ill health at this stage of life, they have access to youth-friendly inpatient care, to more specialised youth-orientated systems of care which span the traditional child and adolescent adult divide. The paediatric adult model, it serves general health care quite well, but it's poorly designed for the mental health field. We need a strong youth mental health system at the primary and secondary and tertiary levels of care so that teenagers and emerging adults who bear the main burden of mental ill health are offered early intervention and sophisticated specialised mental health care to help them maximise their potential over this critical period of the lifespan. Australia is supporting these reforms very strongly, and professionals and leaders in other parts of the world have played a major role in bringing this issue to the fore, and we hope to make this one of the key grand challenges in mental health reform over the next decade or so around the world.